Well, also in Sacramento, a major showdown is expected this week over the homeless crisis in California.
Governor Newsom pushing for a controversial plan that he says could get 10,000 mentally ill and drug-addicted homeless people off the streets and into shelters with services.
Well, KCAL News political reporter Tom Wade joins us now with more on the concern surrounding this costly proposal. Of course, you've been looking at this very issue for years.
That's right, Pat. As we've been reporting, the governor has been saying, the status quo is not working, so we've got to change it. We'll see what happens, though. One of the major issues here in Southern California and across the state, a lack of beds for anyone really needing housing, but certainly it's even worse for the addicted and mentally ill. The governor is pushing to change that, but some say he could make the situation worse. Homeless crisis at a crossroads. Governor Gavin Newsom and Democratic state legislators are up against the clock to overhaul how the state approaches the mentally ill and the drug addicted living on the streets.
People are dying from overdoses every day.
Veronica Lewis is with HOPIX, an organization that provides a vast range of services to the unhoused, including substance abuse recovery and mental health rehabilitation.
We desperately need more investment in substance use disorders. A number of people who are living outdoors on unsheltered want to go to treatment, but there's not sufficient resources.
Newsom and Democratic lawmakers are pushing two bills. Both would either redirect or generate billions in funding for supportive housing and aim to create space for at least 10,000 new beds for those with mental health or addiction issues. Some critics worry the overhaul may reduce other services for those experiencing homelessness and make the situation worse. Lewis supports the bills. She says big changes are needed.
And there's all these other efforts to try to get the most ill, the most sick people off the street that can't necessarily take care of themselves, and we can't do it if there's nowhere to put them. I support both of them. I understand some of the concerns around our mental health services going to be impacted, but the reality is folks are dying on the street. And there's a significant amount of addiction on the street.
LA County is also poised to implement what's being called the CARE Act, which will allow officials to force those on the street into treatment if they cannot help themselves. But the question becomes, where would these new patients go if there is no space?
The issue of people experiencing homelessness is a complex one. Not all of the people experiencing homelessness have mental health issues or substance abuse issues, but certainly we can recognize that some do.
And there's also the politics of the homeless crisis, with Governor Newsom consistently positioning himself in national politics. Images of a dystopian California could hinder a potential presidential run, one the governor has denied he is chasing, at least for now.
Nationwide, the national media is largely making a laughingstock out of California for the homeless crisis that we are facing. And no doubt, Gavin Newsom, who constantly is putting himself out there in the national media, receives the brunt of that animosity.
The two bills in question would not increase taxes. The current funding comes in part through taxes on those who earn more than $1 million a year. The bills are expected to clear the legislature, but voters will get the final say next spring during the presidential primaries. I'm Tom Waite, KCAL News.